The next company this morning is Carocell Bio. Carocell Bio is developing novel peptides, small proteins with nanoparticle delivery to more safely and effectively treat inflammatory diseases. Their lead is to prevent the formation of scars after operation. Presenting today is the founder and CEO, Dr. Mike Davies.
Thanks very much, Larry. That was very kind of you. Thank you. Hello, I'm Dr. Mike Davies. As Larry says, we're developing novel peptides to prevent the formation of a scar after an operation. As you may know, there is absolutely nothing at the moment that prevents the formation of a scar after an operation. Currently, $37 billion are spent each year to treat existing scars, and nothing really works. Things such as pressure garments, high pressure water for some reason, creams, ointments, oils, steroid creams, nothing works. We're developing a new steroid-free formulation that will be safe and prevent the formation of a scar. The solution here is inflammation. Inflammation is responsible for the formation of a scar. It leads to the collagen deposition, it leads to the formation of a scar. We're targeting the orchestrator of inflammation, but with these peptides. We use a nanoparticle delivery to take the peptides into cells, as you can see in this middle picture. And what's key is we bind at a very different site on the enzyme that causes the inflammation. We bind at an allosteric site. So by reducing the inflammation, we can reduce the collagen deposition and prevent the formation of a scar after an operation. This will become a spray formulation that the surgeon will use at the close of the operation. So opening the skin, do the operation. After suturing, closing the skin afterwards, the surgeon will spray down the wound. This will deliver the nanoparticles, which will deliver the peptide, which will switch off the inflammation, which will reduce the collagen deposition and reduce the formation of a scar. It will be used once a day for up to a week after the operation. As I've said, it's a $37 billion market, and there were 234 million operations worldwide in 2019 alone. Every one of those would have got a scar. We could work in every single one of those. There's nothing that prevents the formation of a scar, and everybody gets a scar after an operation. We've got patents in the US, in Europe, and Japan, and we've got patents pending in China. We have conducted important cellular studies that have demonstrated that we can not only switch off inflammation, we can prevent the activation of inflammation. And we're doing some important human tissue studies by taking biopsies from people who've been burned, putting our formulation on, and showing we can switch off the inflammation, because it's known that that inflammation leads to scarring. Big Pharma, J&J, AstraZeneca, Galderma are very excited with what we're doing, but we need your help to get us there. We've got a great team. Myself, I'm Mike Davies, founder and CEO. I have a surgical background. I was a pediatric cardiac surgeon at Great Ormond Street in London. John Nicholson is our chairman from Cambridge, and Anne McKee is our chief financial officer. We've developed drugs that are already on the market. We've taken drugs to exit. We've got over 55 years of pharmaceutical experience, and we've raised over $200 million. We're seeking $3 million over this next year. This is how it fits in the investment strategy to get us to clinical proof of concept, where we see the big payout in drugs. We've raised so far 1.5 million. That's with Innovate UK grants and with some seed investment from Deep Root Capital, who have said that they will contribute to this next investment. And I've also put in some money myself. We're seeking 3 million in which to develop the formulation and do a scar proof of concept study. Thank you very much. These are my contact details, and hope to see you in the breakout room afterwards.